People ask me all the time, did the anxiety cause my tinnitus or did the tinnitus cause my anxiety? And I get why that's confusing. If you have both, they're almost impossible to separate. Your ears are ringing and you're on edge. You can't sleep, you can't concentrate, and at some point, you stop knowing what started what. So today, I want to give you a real answer, not stress makes tinnitus worse, which sure, but that's barely the beginning. I want to show you what's actually happening in your brain when tinnitus and anxiety get locked together, why that cycle is so hard to break, and what that means for treating your tinnitus.
If you're navigating hearing loss or struggling with ringing in your ears, then you've come to the right place. The All Ears Hearing and Tinnitus podcast is your go-to source for expert insights, real stories, and cutting-edge solutions in hearing health. We'll dive into the latest advancements in hearing healthcare, explore groundbreaking treatments for tinnitus, and offer practical tips for better hearing. Here to help you tune into a world of better hearing, here's your host from Timpanogos Hearing and Tinnitus, Dr. Layne Garrett.
I'm Layne Garrett, founder of Timpanogos Hearing and Tinnitus here in northern Utah. And after 20 years of working with tinnitus patients, this tinnitus-anxiety connection is one of the most important things I help people understand, because understanding that is genuinely part of getting better. First, let's establish how common this overlap really is. Research tracking a large national representative U.S. sample found that frequent tinnitus was associated with generalized anxiety disorder at a striking rate. People with frequent tinnitus were 6 times more likely to have anxiety disorder than those without it. 6 times! And research has documented that mood disorder comorbidities among tinnitus patients can reach 60 to 80%. So this isn't a coincidence. Something structural is going on between these two conditions. The question is, what? Now here's where it gets interesting. The research has actually started to answer the which one comes first question. And the answer is both, genuinely. A 2025 bidirectional Mendelian randomization study using genetic data from multiple large European datasets found a genetic correlation between anxiety and depression and an increased risk of tinnitus, suggesting that anxiety doesn't just follow tinnitus, it can predispose people to developing it in the first place. Mendelian randomization uses genetic variation to test causal relationships. It's considered second only to randomized controlled trials in terms of evidence quality. So when a study like this finds that anxiety and tinnitus influence each other at the genetic level, that's not a minor finding. What that means practically, if you have an anxious nervous system, one that's generally more reactive, more threat sensitive, you're more likely to develop bothersome tinnitus when the auditory system gets disrupted. Your brain is already primed for threat detection. When tinnitus shows up, it gets flagged immediately. And it runs the other direction too. A large retrospective study using data from over 140 million patients found bidirectional relationships between tinnitus and generalized anxiety disorder. Patients with tinnitus were more likely to develop anxiety disorders, and patients with pre-existing anxiety disorders were more likely to have more severe forms of tinnitus. Both directions, which brings us back to the mechanism. The reason this cycle is so hard to break isn't willpower, it's neurobiology. According to Jastreboff's neurophysiological model of tinnitus, one of the most influential frameworks we have for understanding tinnitus, the amygdala in the brain is a central player. When there's an emotional reaction to sound, subsequent exposure to that sound maintains conscious awareness without habituation. That's the core problem, habituation. Learning to tune out a sound is how most people eventually stop noticing sounds like the refrigerator or road noise. But when a sound gets tagged as threatening, the brain doesn't habituate to it. It stays on alert. Brain imaging confirms this. Tinnitus-related distress involves heightened functional connectivity between the auditory cortex and limbic structures, including the amygdala, anterior cingulate cortex, and the insula. And individuals with distressing tinnitus show increased activity in the salience and default mode networks, the systems involved in determining what deserves attention and emotional weight. Your brain has built a fast, automatic connection between I hear this sound and something is wrong. And anxiety widens that connection. More anxiety means more attentional resources directed towards the tinnitus. More focus on it means more distress. More distress means more anxiety. That's the loop. And it's not a metaphor, it's measurable. I see it every week. Patients describe tinnitus that explodes when they're under stress, before a big presentation, during a conflict at home, in the middle of a sleepless night. and they assume that tinnitus is getting louder. Most of the time it's not. What's changing is how much attention and emotional bandwidth the brain is directing towards the tinnitus. The patients who struggle the most aren't always those with the loudest tinnitus. Some people with objectively quiet tinnitus are deeply distressed. Some with very loud tinnitus are barely bothered. The difference almost always comes down to how their brain has classified the tinnitus. Is it threatening them or is it not threatening? And that shapes everything about how treatment has to work. If the cycle is neurobiological, the treatments that work have to address neurobiology, and they have to address it from multiple angles simultaneously. Treating just the tinnitus or just the anxiety and expecting the other to resolve on its own is the mistake I often see when patients come to us after years of not getting better. So let me walk you through what a comprehensive approach to treating tinnitus actually looks like. Hearing loss, and this is the one thing that gets overlooked constantly. If hearing loss is present and untreated, your brain is being chronically deprived of the auditory input, which drives the hyperactivity of the brain that generates the tinnitus in the first place. Treating the hearing loss with properly fit hearing aids restores the input, gives the brain something real to process, and takes the direct pressure off that tinnitus anxiety loop. It's not a side issue. For many patients, it's foundational to their therapy. Then there's sound therapy. The brain needs rich auditory environments to reduce the tinnitus signal. Sound enrichment, whether it's through hearing aids, sound therapy apps, or even background noise at night, gives the auditory system something else to listen to. It works on the bottom-up side of the cycle, reducing how prominent the tinnitus signal is relative to everything else the brain is taking in. Then cognitive behavioral therapy principles. This is the top-down side, and I know what some of you are thinking. My tinnitus is a real sound. Why would talk therapy help? Because cognitive behavioral therapy isn't treating the sound, think of it as physical therapy for your brain's reaction to the sound. It targets the threat evaluation process directly, the part where your brain classifies tinnitus as dangerous and locks its attention onto it. Research clearly shows that patients with higher anxiety levels and more severe distress from their tinnitus tend to benefit most from this approach. That's not an accident. That's cognitive behavioral therapy working exactly where the cycle is most active. In our clinic, we deliver this through a structured program called My Tinnitus Therapy, which teaches cognitive behavioral therapy principles specifically adapted for tinnitus. For patients where the anxiety is more severe and independent, where we're dealing with clinical anxiety that goes beyond tinnitus reactivity, we will coordinate with mental health professionals who specialize in that. That's not a gap in our care, that's an appropriate scope. The tinnitus and the anxiety both need the right expertise. Then there's linear. For patients where the neurological component is significant, we offer linear bimodal neuromodulation, the only FDA-approved device that works by pairing sound stimulation with a mild tongue stimulation to retrain auditory pathways at a deep level. It's not a first-line treatment for everyone, but for the right patient, it addresses the cycle at the neurological root rather than trying to just manage symptoms. And then lifestyle. There are things that either feed the cycle or starve it. Sleep is the most important. Poor sleep reduces the brain's ability to regulate emotion and sensory input, which means the tinnitus gets louder and the anxiety gets spiked and the loop tightens. Sleep hygiene isn't optional for serious tinnitus management. And exercise is genuinely helpful. It reduces the physiological stress, improves sleep, and gives the nervous system a healthy outlet for arousal that will otherwise amplify your tinnitus. Alcohol can disrupt sleep, even when it feels like it's helping you relax, so it's worth tracking how much you drink. Caffeine is one thing that patients ask me about constantly, and I want to be straight with you. The evidence here is mixed. Some studies actually show higher caffeine intake associated with lower tinnitus occurrence. A randomized control trial found no significant difference in tinnitus discomfort between the caffeine users and a placebo. What matters is whether caffeine is affecting your sleep or your anxiety, because both of these feed the cycle. If you're drinking coffee at 3 o'clock in the afternoon and staring at the ceiling at midnight, that's relevant. If your morning cup isn't touching your sleep or your stress levels, the evidence doesn't support cutting it out. Track it honestly and let your own data answer the question. So back to the original question, which comes first, tinnitus or anxiety? The honest answer is that once both are present, the question matters less than understanding what's keeping the cycle going and attacking it from every angle that's relevant to you. Not one treatment, not two, a coordinated plan that addresses the auditory system, the brain's threat response, and lifestyle factors that can either sustain the tinnitus loop or help to break it. If you've been told there's nothing you can do or just ignore it, that advice is neurobiologically backwards. Willpower doesn't override a limbic threat response. Treatment does. Drop a comment below. Do you notice your tinnitus is worse when your anxiety is up? Or did the anxiety come after your tinnitus started? Your experience can help other viewers understand that they're not alone with this. And for a deeper look at the treatments I mentioned, my tinnitus therapy, linear, sound therapy, and what a comprehensive evaluation actually involves, I've put together a free learning center with detailed guides. You can find the link in the description. And if you're here in Northern Utah and want a real tinnitus evaluation and a comprehensive treatment plan, you can schedule directly through the link in our description.
A world of better hearing and relief from tinnitus is within reach, and we're here to help. Be sure to subscribe to the podcast right now and join us on the journey to clearer sound and a richer life. Thanks for listening to the All Ears Hearing and Tinnitus podcast with Dr. Layne Garrett. We'll see you next time.